Hello, 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 good people, and welcome back, everyone. This is us tackling a new subject today that for therapists will be helpful. And I think since I talked about continuing education last week, I wanted to really focus on understanding the importance of handling ethical dilemmas in private practice. This is Wednesday Wisdom with Sharia, and I hope that you're ready to go. All right, so let's talk about it. How do we do this when it comes to understanding this topic? I want to come from the perspective of we all encounter ethical dilemmas in private practice, whether we like it or not. Especially when we're in solo practice or we're alone in our own world, it can become really challenging to understand these situations as ethical dilemmas and or have the ability to make a ethical decision without support. And so my first thing is I want to give us 3 points as always, because that's the way I'm sticking to it. I've been trying to keep it down under 5 minutes. Um, but really, when it comes to really thinking about how to deal with ethical dilemmas, it's essential to start with a solid foundation by understanding the ethical guidelines of your profession. Every therapist is responsible for knowing their individual guidelines by their license and licensing board in their different areas. So that's where I would say to start. There is so many of us who will go out on our own and kind of remember the knowledge of our school. And depending on when you went to school, that could be a long time ago, but the guidelines are current and a roadmap to serve us on where and what actions we should take when it comes to professional and best practices. So we have to think about it like this. If we have a board and or a license board that provides licensure, they're staying up to date, and it's our requirements to kind of know and be able to research how to make our decisions based off of those board requirements currently. It helps us to keep our professional integrity. The next thing is tip number 2 is consulting with peers or supervisors. Now, many of us who are in private practice no longer have the requirement of supervision. However, you don't have to figure it out all on your own or by yourself. For me, I have always maintained a peer consultation and or supervision in some capacity. Consider even in private practice or solo practice, how can I set up an environment of support that allows me to do just that? Sometimes this allows us to get into the deeper situations that we sometimes are having our own individual blind spots around. A trusted peer can do something that really you can't do for yourself, and that's offer new perspective and insight, helping you to weigh into what are the options, what's the most effective way to do this, and knowing that you'll be able to face it or have faced it. They may have faced it in other ways themselves, but knowing that they'll be able to give you advice based off of their experience is helpful because it changes the viewpoint of only one perspective. The last thing is documentation. Even in private practice, it is important for you to remember that documentation is key. Whenever you deal with an ethical dilemma, you need to keep detailed records of your thoughts and the process. These steps that you considered can eventually be a process for you to give, um, could be something that you need to use if ever there was a legal and or professional issue that you had to prove that you made the best decisions and or got the best support. So many times when we're doing this, part of that documentation is even documenting that you had peer support and you also got the permission and consent of the client to discuss it based off of what your makeup of your practice is. Documentation always helps. When you not only are you making decisions, it helps you to clarify your intent and to demonstrate your care and consideration for your client and the whole situation. All of that to say, handling ethical dilemmas is part of the running of a private practice, whether you like it or not. And while there's so many situations that I'm not going to try to describe, we all may have challenges. Our approaching them in a thoughtful and defined way is our means to respecting our profession and our client. You need to understand your guidelines, seek consultation with others, as well as make sure that you are keeping documentations and good and clear records if you ever have to do anything to prove yourself. On that note, take good care of yourselves, like and subscribe and share. And I hope that you keep and get the support you need when you're dealing with any dilemmas. All right, be well.